Meanwhile, Democratic governors in red states like Kentucky and Kansas have been warning of the consequences if Republican lawmakers in Congress do pass this massive budget bill, as they are expected to do a short time from now. Those leaders say it would take health care and food assistance away from Americans who need it most. The bill cuts Medicaid, as we've been telling you, by $930 billion. It also cuts another $285 billion in food assistance. The Congressional Budget Office estimates nearly 12 million Americans will become uninsured by the year 2034 if the bill becomes law, and 3 million more will not qualify for food stamps known as SNAP benefits. Joining us now is the Democratic governor of Kentucky, Andy Beshear. Governor, thanks for joining us this morning. As we've been discussing for the last several hours, it does look like Speaker Mike Johnson has the votes among Republicans to get this bill through, to get it on the desk of the President of the United States, who says he will sign it by the 4th of July. As you read through the details of this massive piece of legislation, what will be the impacts in your state?
Oh, it's going to be devastating. This is the day that Donald Trump and the Republican Party are telling the American people, especially in rural America, that they don't care about us. You look at what's going to happen in my state. 200,000 of my people are going to lose their health care coverage. 20,000 health care workers are going to lose their job. This is the Republican majority firing Americans that right now have a good job. And 35 rural hospitals may close, which is going to impact every single community they're in. What people don't know about rural hospitals is that they're typically the largest or the second largest employer in their communities. So you lose all those jobs, and every small business in rural America is going to be impacted by having fewer people, less dollars cycling through. And then when you think about worker productivity for America, it's going to take a nosedive, because now you got to drive 2 hours to go see a doctor, not just for your appointment, but for your kids and your parents. And when your parent or grandparent gets kicked off Medicaid because they did not check a box, you're going to have to bring them into your own home, take time off of work, and ultimately pay for their medical expenses out of pocket. This is just crazy. It's going to hit Democrats, Republicans, independents. It's going to hammer the U.S. economy. This is the worst bill I've seen in my lifetime.
So as you grapple with this, what seems to be inevitable, that this is coming your way and to states across the country, how do you plug those holes as the governor of Kentucky? If 35 rural hospitals are closing in your state, what do you do about that on the state level?
No state has the budget to fix what the federal government that Donald Trump and the Republicans are about to break. No state can make up for hundreds of billions of dollars of Medicaid payments flowing through our economy. If you just look at the economy at large, healthcare is one of the fastest growing segments out there. And this is the Republicans just taking a hatchet to it. We're going to see job losses across America. And listen, we're going to do our best. We're going to do our best to plug some holes where we can. But even when you look at food assistance, which, my faith teaches me that in a country that grows enough food for everybody, nobody should starve. I mean, the miracle of the fishes and the loaves is in every book of the gospel. But look at what they're doing. Seniors and children are going to go to bed and wake up hungry. That's just wrong. And just the administrative costs pushed on Kentucky is an extra $66 million. So you think about plugging other holes. On top of that, you have the president not approving public assistance after natural disasters. That may cost my state another $300 million. So what this federal government is doing is fiscally wrong. It's going to add, trillions of dollars to the federal debt, but it's also going to blow up every single state budget where we have to balance those budgets. And I don't buy for a minute that they have to cause all this pain just for a tax cut. In Kentucky, I've expanded Medicaid while at the same time lowering the income tax and the property tax rate multiple times.
Governor, as a governor of a red state, you're a Democrat, but you, by definition, have to work with Republicans. You always have. You continue to do that. How do you explain the vote taken by Republicans in Washington right now in Capitol Hill, many of whom, all of whom, know exactly what you've just said, that it is going to cost their own constituents, the place where they live, the people who voted for them, their health care in some cases, or the hospital that they've counted on for all of their lives. Is it anything more than feeling the pressure from President Trump, who was up all night calling members, who was up all night posting to social media saying MAGA will not be happy with you, talking about his own movement if you vote against my bill? In other words, how do you explain the members of Congress, let's just take your state of Kentucky, voting against the interest of many of their constituents?
Well, it seems like they care more about being a good Republican than a good representative or senator. I mean, they're elected to represent the people of their districts. And for every Kentucky congressman or senator that's voting for this, it hammers their constituents. People are going to lose their jobs that voted for them and that voted for the president. I mean, people have lost their way if they think their number one job is to stick with their party instead of their people. You look at all the congressional delegation that voted for it in Kentucky, every single one has a rural or an urban hospital that's going to get hit. Every single one is going to run into someone that's going to lose their health care and not be able to get a cancer treatment. Every single one has people in their districts that will die if they do not have health care coverage. Listen, I remember when we expanded Medicaid, my dad was governor at the time, and I was in an elevator with him when a woman walked in, burst into tears, and said, I'd be dead without you, without that expansion. She could not get coverage because they considered cancer a pre-existing condition. But with the expansion of Medicaid and the ACA, she could. These are real lives at stake. These are real people. And this is a huge betrayal. People care more about their families than they do their political party. And so Democrats, Republicans, and independents in Kentucky are going to react and react incredibly negatively when their friends are losing their jobs at their hospital.
Governor, it's Ali Vitale in Washington. We were just talking with Ken Martin, the head of the DNC, about how this bill, in terms of the issues that it brings up, is a gift politically in some ways for Democrats to take back out on the campaign trail in 2026. But there are concerns from advocates about the message, this perennial concern that we've heard since 2024. You're someone who has been playing in the space of trying to find different ways of communicating with new constituencies. What do you see in this bill, and how do you think it could be best communicated by Democrats as they head into this midterm year?
Well, as Democrats, we've got to recognize that when people wake up in the morning, they're not thinking about their next election. They're thinking about their job and whether they make enough to support their family. A lot of jobs are going to be lost. They're thinking about their next doctor's appointment and how far they have to drive. It's about to get a lot tougher. They're thinking about the roads and bridges in their community. They're thinking about the school they drop their kids off at. And they're thinking about whether they feel safe in their community. And if they don't have a hospital that ambulance is going to rush them to, they are not as safe as they were before. We've got to talk about the impacts about this bill and the everyday terms of how it makes people's lives harder, and it does. And if you combine that with tariffs and costs going up on everyone, this president has done everything he promised not to. I think he ended up getting elected because people believed he'd make paying the bills just a little bit easier, and it's about to get a whole lot tougher.
Democratic Governor of Kentucky, Andy Beshear. Governor, thanks as always for your time. We appreciate it.
Thank you.